Hello, everybody out in TV land. You know, this is Senior Issues, etc., and I'm your host, Vita Verdon. And I'm so grateful for all of you that stop me in Walmart and Sam's Club and Salvation Army and the grocery store, and you tell me what you want to hear. And you send me emails, and what has been at one of the top of my list, you want to know about sleep disorders, about sleep apnea. That's the thing of this day. What's sleep apnea? Well, we have a specialist here today, and I'm a very biased person. She's the doctor of this, and she happens to be my doctor, and this is the second time that she's on the show by great request. So what we're going to learn about is how to handle it, what the changes are, and we want to give a warm welcome. Hurry up, get your coffee, get your iced tea, get your beer, get your pencil, and get your paper, because you're going to get vital information. Now, I bring you this vital information, and it's up to you to act on it and record on it and respond on it, because it's information that you need. So now that you're seated, I want you to welcome and sit back and relax Dr. Smita Patel. Dr. Patel, nice to have you back on the show.
Thank you, Vita. It's my pleasure.
And now there's a lot of people that are watching right now because we've increased in our size of our audience. We're in more communities today than ever before. So they'd like to know something about you. So if you would just look into that camera and give us a little bit about your background, I know our audience would love it.
Sure, happy to. So I actually grew up in Morton Grove, Illinois, and did my schooling here, and finally became a doctor. I trained for a sleep fellowship at University of Chicago, and I've been working at North Shore University Health System since then. So that's out at Glenbrook Hospital in Glenview, Illinois, and so that's kind of where I'm at.
Well, what I have, every single person that comes on the show, bar none, blows some smackaroonies right into the camera. So
I'd love
you have
to say
some people?
I do. I have my two children.
With their names?
Jasmine and Kaylin Mehta.
Well, one for Jasmine, one for Kaylin.
And then one for my hubby.
Okay, what is his name?
His name is Snehal Mehta.
Snehal Mehta. I'm giving him one and one for each of your daughters. Okay? Okay, so now what we'd like to go into is what we'd like to learn the definition of is what is this mystique of sleep apnea? What does that mean?
Sure. So sleep apnea is a condition that occurs during sleep. Apnea, by definition, means that you stop breathing momentarily, of course.
So that's dangerous, right?
It's a pretty serious condition. And the biggest sign that some people get is snoring, which a lot of people don't think is a serious problem.
So would that be a sign? Write that down.
That would be a sign. That would be the biggest sign if you actually do have sleep apnea. So sleep apnea is intermittent pauses in your breathing while you're sleeping.
If I go like that?
Right. So it doesn't happen during the day when you're awake, of course, but I know you're trying to mimic that. And so it happens at night. So someone else is probably watching you, hopefully, to catch it, because you yourself may not otherwise know that you're stopping breathing during the night.
Well, how about if a person sleeps alone?
Right, so they may not get caught, but they have other symptoms. So sometimes they naturally have slept, in a hotel room with someone, or their kids, or their grandkids kind of caught them sleeping and snoring, and so kind of have to listen to what other people have to say about you when you're sleeping in the same vicinity, maybe. As well as how you feel during the day then. So you may not get a restful sleep, and so you'll be very tired during the day. You might be irritable. You might not act your normal self, taking a nap after lunch or something that's typically not you, but you've done it for so long, so that's just how you feel, and that's what you think is right. But another problem is that some people also have drowsy driving. So that's another thing to kind of watch out for, because those are symptoms that you're not getting a good restful sleep at night, and we should probably check up on why.
Well, I'd like to ask you a question. Is this just within the last 10 years, or before wasn't it recognized? Or was it recognized but just kept under?
I think it was kept under the radar for a long time, but it's been known for a very long time. We've known about sleep apnea, and the CPAP machine as the most common treatment has been around for a very long time. But I think it's been kind of under the radar, underdiagnosed for a long time. And again, I think mainly because people don't understand that snoring is actually a serious condition. There are people who snore and don't have sleep apnea. I don't want them to have wrong information. But a lot of times snoring is an indicator that you actually have sleep apnea.
Now, I know the treatment in the past was that you had to go to a hospital, right? And what did they call that, a sleep lab? Because I went through a sleep lab.
Right, so we still have a sleep lab for many reasons. We still need a sleep lab, different kinds of sleep disorders. But for sleep apnea specifically, we can actually do a home sleep study now, which is exciting. So people can be studied in their bed with their environment, their pillows and blankets. So that's a really nice, attractive feature for many, that you don't have to come to someone else's bed wired up. And so now the home sleep study does have a monitor on you, but it's quite not as extensive. And I brought one to show.
Well, in the latter half, we will show that and show some information. But now I know that that everybody is near, this covers a wide range, so they're not all near the hospital. So what I'm going to say to all the audience out there, if they want some questions answered, what they can go is they can go to my website, that's seniorissuesetc.org, and then they can contact me. My contact material is there, and any questions that they really want answered, that they can filter them, and I can direct them to the source. And if some need to be directed to you, I will direct them right directly to you.
That sounds great.
And also that they could go to their own primary doctor, which is usually a doctor of internal medicine, to recommend them. Like most seniors have Medicare, so they'd have to go to their primary doctor, and then their primary doctor would recommend somebody, because everybody has an insurance system today. See, I happen to belong to the North Shore system. So we'll recommend somebody within the system that they can go and check this out.
Right.
And like you said, that snoring doesn't have to be an indication, but if one has it, it'd be a good thing to check, because you say sleep apnea is a serious problem. Now, could somebody die from that?
Yes, I mean, we don't like to think about that, but the reality is that untreated sleep apnea does have higher risk of having other cardiovascular risk factors, like having a heart attack or having high blood pressure even.
Oh, so it affects other areas of your life, other areas of your health. Is that correct?
Yes, that is true. So treating it reduces those risks, but untreated sleep apnea does increase the risk of having those things.
I see. So in other words, that carrying sleep apnea without having full treatment for it, if I'm hearing you correctly, can affect some other weakness or disability within your system to break that down, because it's such a strain on your body. Am I correct?
That's right. So it's actually the lack of oxygen.
It's the lack of oxygen.
Right. Because what's happening with obstructive sleep apnea is that the airway is collapsing. And so air, which normally comes through the nose or the mouth into the lungs for air exchange, well, the airway's collapsed. So we can't get it down there, and we can't get it back out unless you open up your airway. So when you're sleeping, naturally we all lose some muscle tone, and that airway gets reduced. So when we don't get that oxygen down, then that's a problem. And that's what kind of contributes to if it's just one time, that's usually not a problem. But with sleep apnea, that process happens again and again and again during the night, which is the whole problem. So lack of oxygen throughout the night when you're sleeping contributes to high blood pressure, heart attack, stroke, gaining weight, diabetes, right?
You know, so it contributes to major diseases. So then I would think one recommendation, like if a person is married or sleeping with another person, then if the other person notices, if the person themselves doesn't notice it, then it's the other person who's with them, they should bring that up.
Definitely. So if snoring by long pauses or a pause in the breathing followed by a loud snort, you know, those are things to watch for if you are sleeping with someone, or not necessarily. Like I said, grandkids have detected sometimes someone not breathing properly.
Right.
So
you can tell so even if the person is sleeping alone and they suspect, if they have irregular sleep habits and they suspect, they should check out what they suspect, right?
That's right. Again, if you're having symptoms, you're having snoring, you're having daytime fatigue, maybe you're treated for high blood pressure, but that's a risk factor. Neck size is another big risk factor that we're noticing. So men with a collar size of 17 inches or greater, women with a collar size of 16 inches or greater do have a higher risk for having sleep apnea.
Yeah.
And so if you say yes to any of these, you know, you probably should talk to your doctor about further testing.
Well, we're going to go further into it, but right now we're going to do Vita's Pearls of Wisdom. Okay, now my Pearls of Wisdom, I harp on the same things all the time. We're in the voting season. Now, being in the voting season, we are seniors, and it's our responsibility not to be couch potatoes, but to get out there and vote. Now, in the league in the blocks, from the surveys that I have seen, that 80% of seniors are signed up to vote, and I think it's somewhere between 75 and 78% actually come out. So that's a pretty good turnout, except that what we could raise the number is that more people sign up to vote, and it's so easy to sign up to vote. Now, as I say personally, I have voted already because I have voted by mail. But now, if you can't get out to vote, or it's too late to vote by mail now when you see this show, then call somebody. You can call your alderman. You can call the I live in Lake County, the clerk's office, or where you got your voter's card, who helped you sign up with your voter's card, and they will send somebody to help you to make sure that vote counts. Now, what I'm going to tell, I happen to be a person who has sleep apnea. I'm going to tell you my experience, how I found out that I had sleep apnea. I happen to sleep alone because I live alone, okay? But I was having irregular sleep habits, but I didn't think them to be of any serious nature. So I was driving about every other day my brother was in a nursing home about 20 miles from where I lived. And I came up to a stop sign, and you know, I fell asleep at the stop sign. And I tell you, upstairs, the Lord was with me, that I didn't have an accident or something serious didn't happen, but I knew that I was in trouble. I knew at that point that I was really in trouble for me to do that and not even be aware of it. So I immediately went to my doctor, which referred me to the sleep clinic, and this is how I connected with Dr. Patel. And I can honestly give a testimony of, it's been more than 5 years now, and that it's just such a relief to me. I started out with a kind of larger CPAP, but technology is getting better. Now I have a very light one, and one has to go through like a time of adjusting to like how much oxygen and adjusting to the masks and just adjusting to that you're sleeping with an apparatus on. And in the second half of the show, we're going to go into some of these apparatuses and how they work to make this information available to you. But I can give 100% testimony that what a relief and a blessing it has been in my life, and how it has changed things. It's helped me. It's even helped me lose some weight, and I know I need to lose more, but I'm not finished yet. I'm still working on that, and that it's a testimony to get some personal consultation on how you should do it. And I feel like I have the best sleep doctor around, because she's my doctor, and she has taken a personal interest in me and helped me to adjust to my devices in many ways. Now we're going to go back and we're going to go a little deeper into this, into the devices. And I'm just so happy that you're in my life.
I'm so happy you're in mine, Vita. Thank you, thank you.
Okay, the first one is...
So first, I thought we would talk about more of the diagnosis,
right?
Because
that's important.
A pretty big change that has occurred in the recent times.
Yeah.
So you don't have to come into a lab now. For the most part, again, if we're looking for something like sleep apnea, we have this portable device that we can attach onto you, teach you how to do it. You can go home, and then you can sleep in your bed.
And this goes up.
So this is a snoring mic, and we would just kind of tape it on there. Right now you're just going to hold it. And so it's also a body position device. So it helps me know, are you sleeping on your back in the sleep study, or are you sleeping on your side? As position sometimes makes a huge difference as well. Those people who sleep on their back could snore more versus on your side, who you may not. Now, it's not the case for you, Vita, but there are people who are like that. So again, very mobile, very portable, home study device.
Now this is in place of going to a hospital and going through their sleep clinic. And you can see it's really not that cumbersome, and it's the way that you get results. And as she said, like taking care of this problem will help you with any other problem. So this is very important that you see this, because this is the latest breakthrough that there is, because a lot of people shied away. They were fearful or hesitant to go into a hospital,
That's
right?
right. I mean, in the hospital, we put electrodes on your head, and it's like goo on your head, and many women didn't want to go through that, especially if they just got their hair done. But you can see that this is not even, we're measuring brain activity with this type of device now, because we can look at arterial tone and heart rate through one of this pressure device. And then this one here.
This is your heart rate?
This is kind of measuring a little bit of everything. It's measuring arterial tone, which then helps decide your brain activity.
Okay, doctor, let me ask you a question now. And those pauses when you stop breathing, that also affects your heart, right?
That's right. That's absolutely right. So those long pauses where you're not getting oxygen do affect your heart. And so some people have abnormal heart rhythms, and that can be a result of not getting enough oxygen. We talked about high blood pressure, we talked about heart attacks, but also abnormal heart rhythms also can contribute to, can be because of untreated
And now what
sleep
is this
apnea.
finger plugged to?
Now this finger over here is your pulse oximeter. So
now
it's measuring
explain
how much,
what that is.
That's right. So I'm measuring how much oxygen is in your body.
Okay.
So if you are breathing normally throughout the night, then you should have a nice constant flow of oxygen. But when you have pauses, then you're not getting enough oxygen into the body, and so this will pick that up, saying, look, your oxygen went down during the night when you were sleeping.
Now, does this affect your circulation? It would probably affect your blood circulation, wouldn't you think so?
Well, of course, again, the blood is circulating in your body and you're not getting enough oxygen. That's why it's not just affecting your heart, it's also affecting other organs.
So
like
it affects actually every part of your body.
That's right, and
because
your
you're
brain
out of
too, right? So
oh, your brain.
let's not forget the brain, because you're not. If you feel like you're losing your memory, well, again, maybe you're not getting enough oxygen to it, right?
So that means there's not enough oxygen. I didn't think of that. That's something, and you have to keep those brain cells going. If you don't use them, you'll lose them.
That's another issue, right? But if we
Okay.
don't give it enough nutrients like oxygen, then that's a problem too.
All right, now let me ask you this. They hook up and go to bed. Does it have to be for a certain number of hours?
So we'd like you to at least get, several hours of sleep. The more hours of sleep you get, the more data I can accurately then decide, do you have sleep apnea or not?
Okay, now this is hooked up at home. Now, does this data, is this technically sent into a hospital?
No, so then when the night is done, in the morning you'll wake up and you can just take it off.
All the information is in here.
It's in here, and then
That's a little thing.
and then you'll drop
this little thing has everything. You see it?
right.
It's like a big watch, and that has all the information.
That's right.
And then the doctor takes it and
Right, so then you would come drop it back off in the office. That's how we have it set up. And then we would be able to download the information off this little watch and tell you how your results are. Now, most people sleep okay, so one night is usually enough. But if we need more data, or if something fell off, which time to time happens, but you can see that it's pretty well
it's very lightweight.
put together. It's very lightweight.
Now, is this plugged in, or this is it?
This is it. This
Oh,
is
it's
it.
not.
This
So
is your
it's
device.
wireless.
It's wireless. It's
It's
portable.
hi-fi.
You can
this
get
is-
up to go to the bathroom if you had to with this. Right?
Oh, and you can walk with this.
You can walk around with it.
When I get up, I have to take my mask off at night from my sleep machine.
Right. Well,
Right.
you're already using this, so this is somebody who hasn't been diagnosed.
Yeah, this
right?
is just in the diagnosing
This is
stage.
the diagnosing stage. That's
Okay,
right.
all right, now you're diagnosed. Now we'll go to the next stage.
Okay, so if you're going to the next stage and you do have sleep apnea, we have lots of options, okay? But I just brought a couple because I can't carry everything over. Of course, everybody knows about the big machine. Well, it's not so big, right? It's a
Now,
CPAP
how does
machine.
this go?
It's very light. I'm holding it with just one hand, just so everyone can see. And then you have what we call a nasal pillow. So that's one type of mask. We have many masks out there. And this is actually not your mask of choice, but this is the one I brought to show that it could be very small. And this would connect to another hose and connect to the machine. We can find a mask that's comfortable for you. So this is not supposed to be.
This is a very lightweight mask.
That's right. So we have to find something that's comfortable for you. It takes some adjustment, but once we figure it out, then it becomes very comfortable, as you are already experiencing. Another thing that makes it a little more comfortable is the humidification. So in this machine, I need to just pull on it. You would put water into this little device, which provides humidity while the air is running through here. And the air is there to try to help keep that airway from collapsing. As I mentioned, that the airway loosens, the muscles relax, and so this kind of helps keep that airway
You
open.
have to press this on.
And you just have to push this on, and this over here adjusts the humidity. So how much water or humidity do you want coming through to help keep your airway moist? So it's not just dry air coming at you.
And your doctor will help
It's
you
moist.
adjust the
That's right.
measure.
All of these things are adjustable, and we'll find it to be comfortable for you. So my job is to try to make sure I give you the right machine to blow the right type of air to you. Now,
The right
CPAP
amount of pressure.
Right, the right amount of pressure. So there's different devices, but we find the right one to blow, to blow that right air right to you.
Dr. Patel, you might mention that if you need extra oxygen.
That's right. So, again, that's part of the accommodations and the adjustments. So many times, everybody just needs a CPAP machine and a mask. But in some instances, the CPAP machine doesn't blow enough air to try to keep that airway open for you. And so in your case, we had to give you additional oxygen blowing through. So to try to help oxygenate your airway despite you using this. Now, oxygen alone wouldn't work for you.
Right.
Because that airway is still collapsing.
Right.
But with the device, blowing the air open and then you're oxygenating with the extra oxygen, that works for you.
And then with oxygen, you can't have anybody around that's smoking.
That's right. So, smoking is not something that we want you to do anyway.
Right.
So especially in the middle of the night, nicotine can, worsen sleep, as well as alcohol. Alcohol reduces the muscle airway tone too. So right, with an oxygen tank, no smoking. But other good measures for good sleep is not drinking too close to bedtime. So the alcohol and the smoking, usually go kind of hand in hand sometimes, but not too close to bedtime because it disrupts sleep.
And also what I thought was so neat about my oxygen tank when I first got it is that it replaces itself with oxygen just from the air. I don't need somebody to bring in quarts of oxygen. It just replaces itself.
Right. And so this is actually not blowing oxygen at you. This is blowing air, right? This is just taking air pressure and kind of keeping that airway open for you. And so with the CPAP machine, that's the bottom line, is that it's just blowing air pressure at you. It's not oxygen.
So different people have different degrees of sleep apnea.
Right.
And it has to be diagnosed, right?
That's correct.
So what I'm going to do, first of all, is take off this mask. And we'll talk a little bit about it. Now, I know everybody has questions in this area. And what I'm going to do is I'm going to give my website again. That is seniorissuesetc.org. And there's all the contact information is on there. And also, this show will be up on YouTube within, by the time you see this show on television, the show should already be up on YouTube. And you could show it to somebody online if you can't get it, they can't get it on the day the show is seen, because sleep apnea is coming out in the light now that there are so many more cures for it. Now, have you seen the influx of people coming to you now that haven't come before because people are more aware of it?
I think people are able to detect them on their own because of all these sleep apps they have on these phones now. So they can kind of tape record themselves a lot easier. Videotaping a spouse is really easy. So I get a lot of videos of spouses, taping.
Because of technology.
Because it's now all on the phone. They don't have to find another video camera or something else. It's all right there on their one device, so they can easily just kind of press record and tape, and so then they bring the videos to me saying this is how he sleeps and snores or how she sleeps and snores. So technology has been very helpful that way, that it kind of makes people come in, because if you don't otherwise believe that you snore, well, now I have proof of it. See?
Well, I think that one of the biggest breakthroughs is not having to go to that sleep clinic, because they do glue everything to you, and they come in and check you so much that you hardly could sleep because of that. But I mean, it's a necessary thing to find out. And we found that's how I found out the depth of my disorder,
right.
And that there was help available. And so many people suffer from it. Our job here was just to bring this information. I'm going to have you come back periodically. And now you know what it is. When you out there that have that sleep apnea, remember to get in touch with me. Come to the end of your rope, tie a knot, and hang on, because the best is yet to come. What we want y'all to do this week is catch the spirit. We love you.